Imagine a disease outbreak so devastating it threatens both human lives and the livelihoods of entire communities. That's the stark reality of Rift Valley fever, RVF. And right now, Senegal and Mauritania are battling a particularly brutal outbreak. Since September 2025, they've been grappling with this crisis along the Senegal River Valley, impacting people and animals alike. Both nations have declared a public health and animal health emergency, recognizing the grave danger at the national level and the significant risk to surrounding regions. But here's where it gets controversial. Are we doing enough to protect the communities at the heart of this crisis? This WHO EPI-WIN webinar aimed to address precisely that. The World Health Organization, WHO, hosted an EPI-WIN webinar to shine a light on the crucial role of community protection in managing Rift Valley fever, RVF, outbreaks. The goal? To ensure that responses on the ground, as well as future research, truly reflect the realities faced by communities. This means building trust, actively involving local populations, and prioritizing their safety and well-being. And this is the part most people miss. A successful outbreak response isn't just about medical interventions, it's about empowering communities to protect themselves. Let's break down the specific objectives of this important webinar. Raising awareness. First and foremost, the webinar aimed to educate a wider audience about Rift Valley fever, RVF. This included providing up-to-date information on the current outbreak raging in Senegal and Mauritania. Think of it as a crucial briefing to get everyone on the same page about the severity and scope of the problem. Highlighting community protection. The core focus was on the community protection aspects of preventing and controlling RVF. This means emphasizing community engagement, effective communication strategies, and social protection measures. For example, ensuring access to accurate information in local languages and providing support to vulnerable households affected by the outbreak. Identifying practical actions. The webinar sought to pinpoint concrete actions and knowledge gaps where community-centered approaches can significantly enhance outbreak response. This could involve training community health workers, establishing community-based surveillance systems, or conducting research to better understand local beliefs and practices related to disease prevention. The webinar featured speakers from the WHO, providing expertise on various aspects of RVF and community protection. The agenda included Introduction to EPI-WIN, setting the stage with an overview of the EPI-WIN platform, its purpose, and logistical details. This was handled by the EPI-WIN Science and Knowledge Translation team at WHO. Understanding RVF, a deep dive into what RVF is, its transmission, symptoms, and the specific details of the ongoing outbreak. This crucial information was presented by a WHO expert. Community protection, lessons learned, examining past and present RVF outbreaks to identify key community protection issues. What worked? What didn't? And how can we apply those lessons to the current situation? Again, insights were provided by WHO experts. Addressing community protection issues. A dedicated segment focusing on the specific challenges and solutions related to community protection in the context of RVF. This included discussions on risk communication, community mobilization, and addressing social vulnerabilities. Closing remarks. A summary of key takeaways and a call to action, delivered by the EPI-WIN Science and Knowledge Translation team at WHO. Ultimately, this webinar was a vital step in recognizing that fighting Rift Valley fever requires more than just medical solutions. It demands a commitment to protecting and empowering the communities most affected. But here's a question for you. Do you believe that international organizations are truly prioritizing community-led approaches in outbreak responses? Or are we still relying too heavily on top-down strategies? What specific actions would you suggest to ensure that community voices are heard and their needs are met during crises like the Rift Valley fever outbreak? Share your thoughts in the comments below.